Welcome, everyone, and thank you to those joining us live and those listening in afterwards. I would also like to warmly welcome our guests today, whom I will shortly introduce. I am chairing you today. My name is Sari Westermark. I'm owner, proprietary pharmacist in Vihti First Pharmacy, Finland. I'm also FIP CPS Exco member and vice president of the Association of Finnish Pharmacies. Our topic today in the previous slide, if we will have a look at the first slide, online access to medicines, lessons learned for self-care. Our great panelists today will be Manjiri Karat, FIB Vice President from India, Filipa Alves da Costa, who is Assistant Professor from University of Lisbon, Portugal, and John Hertig, who is a Board President from Alliance for Safe Online Pharmacies, USA. And then we will have some announcements. This webinar is being recorded and live streamed via Facebook. The recording will be available on our website, www.fib.org. You may ask questions using the question box provided. You are welcome to provide feedback to webinars@fib.org. Become a member of FIB at www.fib.org membership registration. And in the next slide, we will see that our webinar today is the second webinar of FIB digital events. Watch the previous webinar at FIB website at events.fib.org. And the previous webinar was online pharmacy operations around the world. The FIB vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. Our mission is to improve global health by supporting the advancement of pharmaceutical practice, sciences, and education. We launched new 21 FIB development goals to transform global pharmacy in September 2020. And this our webinar today belongs to the point 18, access to medicines, devices, and services. We will have very interesting program today. Manjiri Karat will start with the presentations. What are the advantages and disadvantages to accessing medicines online to self-care, low and middle income country perspective? The second presentation will be by Filipa Alves da Costa. What are the advantages and disadvantages to accessing medicines online for self-care, high-income country perspective? And the third presentation will be by John Hertig, and the presentation will be online pharmacies and patient safety in terms of self-care. Then we will have a panel discussion, and you, audience, are welcome to give questions by the Q&A box. What we will learn today, our learning objectives are: what are the advantages and disadvantages to accessing medicines online for self-care? What is the situation in low and middle income countries and in high income countries? What do patients need to know if they would like to use the online pharmaceutical services for self-care? How can we assure patient safety of self-care as part of online pharmaceutical services? What are the trends and behaviors we can improve? And in more detail, online delivery of goods became very common nowadays, and even increased during COVID-19 pandemic and related lockdowns. The way consumers obtain medicines and special type of goods is also changing. In some countries, buying medicines online is becoming common practice because buyers are preferring to order their medicines through a click of a button rather than taking a trip to a pharmacy or a drugstore. However, online customers may have difficulty knowing whether an internet pharmacy is a legitimate operation without the same confidence as they would have had in neighborhood pharmacy. What are the practices in place to make sure that the online patient or customer can rely that they will receive the medicine they need? What are the advantages and disadvantages to accessing medicines online from patients as well as from pharmacists' point of view? Since medicines are regulated products and the need for consideration of ethical issues in access to medicines is important, the online pharmacy services have both advantages and disadvantages. What are the medicines patients are allowed to receive online in different countries? What is the scope of online pharmaceutical services vis-à-vis medicine procurement, distribution, online prescriptions, internet drug information, pharmaceutical services, etc.? And our first presenter is Manjiri Karat. She is FIP Vice President from India. She is also Vice President in Indian Pharmaceutical Association and the Chairperson, Community Pharmacy Division of IPA. And she will present us very interesting presentation. What are the advantages and disadvantages to accessing medicines online for self-care, low and middle income country perspective? Stage is yours, Manjiri.
Thank you so much, Sari. Thank you for this kind introduction. And may I have my video, or I'm fine without it? Yeah, I was just trying to start the video. So my greetings to all the colleagues who have joined from all across the globe. And it's my proud privilege and a great pleasure to be speaking to all of you regarding what are the advantages and disadvantages to access medicines online for self-care in low and middle income countries. And this is like, I'm very happy to discuss this particular issue because now this is something which is newly discussed issue in all these LMIC countries and the world over in current COVID pandemic. So I'll be discussing my outline of my presentation is I'll be starting from the basics. So what is self-care? What is low and middle income countries means? What are the online pharmacies? What does it mean? What are the advantages and disadvantages of online access to medicines in general? Now here I'll be talking about very general issues about the online pharmacies. Then we go to what is the situation in low and middle income countries with respect to the literacy, health literacy in the society. What is the role of pharmacists? eGPP is well established, and what is the status of consumer medicine information in these countries. Then I'll be having a reference to the results from the survey which was recently conducted by the FIP and community pharmacy section of FIP on online pharmacies and distribution of medicines. And with this background, we will be again discussing what are the advantages and disadvantages with respect to LMIC, the country, the LMIC perspective, and then the way forward. So first starting with what is self-care? The World Health Organization defines the self-care as the ability of individuals, families, and the communities to promote health, prevent disease, maintain health, and to cope with the illness and the disability with or without the support of a healthcare provider. So this is something very important, that the self-care means it is very much reliant on the consumer. It is very much reliant on the consumer's health literacy. So what is his understanding of his own health issues? Can he communicate well with can he understand the information regarding the disease, regarding his medicines? Can he do proper communication with the healthcare providers? So when we talk about this self-care in terms of access to medicines, we are mainly talking about the medicines which don't require a doctor's prescription. So they can be called as medicines or OTC medicines. In some countries, they might be called as pharmacy-only medicines. And definitely for the responsible self-medication and responsible self-care, it definitely requires an advice by the pharmacist. So it is also important to note that there is diversity in the OTC medicines landscape, because in some countries, a drug, a medicine which is OTC might be a prescription medicine in the other country. Or the same medicine with higher strength might be a prescription medicine in one country, but an OTC in the other. So there is diversity in the OTC or the self-care medicines world over. Now, to the next slide now. Yeah. So we'll be income countries or middle higher income countries. And so in this graph, as you see, the blue, pale blue and the dark blue color countries, these are all in low and middle income countries category. So part of Africa, some part of Asia, you can see Latin America. These are the countries which are mainly LMIC, but this classification categorization may change from time to time depending on the changing GDP and the changing GNI in the countries. So now let's see what is, can we go to the next slide? What it means by online pharmacies. So in the next slide, we'll be discussing what basically it means by the internet pharmacies. So the internet pharmacies, online pharmacies, e-pharmacies, these are the terms which we use usually interchangeably. E-pharmacies are the online platforms where consumers can purchase the medicines without having to visit the brick and mortar pharmacy. So it is perfect example of an e-commerce. And in last 2 decades, a great deal had changed in the online pharmacy landscape with the rise of e-commerce and digital health tools. Sites. So there are different types of online pharmacies. Uh, Now going to the, yes, next slide. So what are in general the advantages and disadvantages of getting the medicines or having access online to the medicines? So there is of course an easy access and equity for elderly, for the people with disability, for the people staying in very remote areas where the pharmacies are few. Person can get the medicines at the click of the button, at the click of the mouse. So there is great, easier access and technology and can enable tracking of the supply chain. So we can track the medicines. We can also have perfect documentation in online pharmacy. But every new development comes with some sort of disadvantages. So when we are discussing pros and cons, it is very important to know that the online pharmacies pose higher risk for irresponsible
Hello, everyone. I think Manjeri has poor internet connection and we have just lost her, but I'm sure that she will be back. Meanwhile, Sari, can you please give the floor for the next speaker? It might be better, I think. Thank you.
Um, can you hear me now?
Yes, Manjeri.
Yes. So can we go back to the slide? I'm so sorry with my internet. Yeah. Yes. So yes, thank you. Right. So we were discussing about the disadvantages, and so there is a possible disclosure of the confidential information. Now we move on to what is the situation in the low and middle income countries. How is the community pharmacy practice? Now, whatever I'm discussing, this is more in general. There could be good exceptions. So this is my disclaimer in the beginning. So the community pharmacy practice is still evolving from medicine seller status to the healthcare provider status. So in most majority of these countries, the pharmacies are considered as just the shops, like any other shops. And the pharmacists are considered as traders, or sometimes there are no pharmacists present in the shops also. Professional patient care services through the pharmacy is not yet common as is seen in developed world. The good pharmacy practices are not yet developed or not yet established or not yet legalized. And pharmacies are not very strictly regulated. Law enforcement in general is not up to the mark. Though the laws are good, the enforcement part is pretty loose. Access to medicines, when we talk about, we see in most of these countries good network of the brick and mortar pharmacies. So the access to medicines for the majority of the population is good. Looking at the level of the health literacy in these countries. In general, the literacy, not I'm talking about health literacy, but the literacy is also low or not up to the mark because there are different socioeconomic conditions in these countries. And when we talk about health literacy, that is definitely low. So the health literacy among the consumers is low. And because of that, the understanding regarding the health issues, understanding regarding the medicines, how to use it responsibly, or where to access the information, all that and kind of understanding is low. So the confidence, understanding, communication with the healthcare providers is pretty low. And that leads to irresponsible use of medicines, like an underuse of medicines, overuse of medicines, or wrong use of medicines. It's pretty common. And there is no provision of detailed consumer medicine information on the OTC product labels. So usually an OTC product should carry a detailed label because these medicines might be taken as a self-care and not necessarily routed through the medical professionals. And so the consumer should have all the do's and don'ts on the labels, but we don't see OTC labels carrying all this full information. And there is no provision of an accompanying patient package insert on the leaflet with many of these. Pharmacist's role is not yet well established as a patient counselor. Moving on to the situation in LMIC in the next slide. Are there online pharmacies in these countries? Yes, definitely. They have come in last 10 to 15 years. We see presence of online pharmacies in majority of these countries. But there is no particular system for the consumers to recognize which is a genuine website, which is a legal website, or is it going to provide, is it going to give me, hello? Hello? Yeah. Can you hear me okay?
Yes.
Yeah, so there is no, for the consumers, it is not very easy to recognize which is a genuine legal website, and that, so there's no confidence among the consumers whether I'm doing the right thing by ordering these medicines from that particular online pharmacy. The law enforcement is not up to the mark as we discussed before. There is no robust legal framework. I mean, there are no dedicated exclusive laws yet for the e-pharmacies or internet pharmacies. Again, in most countries, some countries could be an exception. There is scope for mishandling, damage to medicines during the transit while the delivery of the medicines happen to the home of the patients. And it is not very easy for the patients to return if they receive the wrong medicines. There is no system to verify the validity of the prescriptions. Whichever prescriptions are uploaded, there is no checks. I mean, there is no mechanism for checking the validity of the prescriptions. Also, e-prescriptions are not yet very common in these countries. So the existing models have potential for misuse of prescription medicines as well as OTC medicines. And the business of brick and mortar pharmacies is affected definitely by the presence of online pharmacies, and it is seen as a stiff competition by the neighborhood pharmacist. And there is some resistance also definitely by these pharmacists in different countries to the presence of online pharmacies. Going forward, is there good use of internet and smartphones in these countries? Yes, there is rapidly increasing penetration of the internet and the smartphones in all these countries, and COVID-19 pandemic has further accelerated use of e-commerce and digital tools in every part of the world. Having discussed this situation in the LMIC countries, can I have the next slide? Uh, in general, when we talk about internet pharmacies or online pharmacies, is everything well? Is it all safe and all is well in developed world as far as internet pharmacies are concerned, the high economic countries, high income countries? A simple one word answer is no, because you see lot of mishaps, lot of malpractices, wrongdoings when it comes to internet pharmacies, even in the developed part of the world. And when many times the Food and Drug Administration or other regulators have to take actions against these internet pharmacies who are doing many illegal things, who are causing harm to the patient's safety. FIP had recently conducted the survey. Can we go to the next slide? And regarding the online pharmacies and the distribution of medicines, a global survey was conducted by FIP and the community pharmacy section. And we received good response from different WHO regions, even though the response from the Europe was highest, 45%. But we also had respondents, the member organizations from different other countries, from Africa, America, Southeast Asia, Eastern Mediterranean, and Western Pacific. So I would say around 35 to 40% of the respondents were from low and middle income countries. These survey results are already presented by my colleague Jaime Acosta in the online pharmacies webinar, which Sari mentioned, that was on 25th of March. So I'll be just having quick reference to some of the survey results which are relevant to us. Can we go to the next slide? So in these surveys, we had asked whether is it easy for the consumers to know which is a legal website? And there was answer, 37.5% of the respondents said there is no established method or mechanism to know what is the legality of the website. And only 18% had said, yes, there is some mechanism. So this is kind of alarming because as I told you, the survey results are from all types of countries, including the developed world, high income countries, and also from the LMIC countries. Can we go to the next slide? And another survey point was, are there dedicated laws to regulate the internet pharmacies in your country? And 50%, that means more than half of the respondents said no. This is again something very, very alarming, very, very interesting, and very, very disturbing also, that there are no dedicated laws to regulate or to control the internet pharmacies. Yes, so having this background, when we again go back to our major objective of discussing what are the advantages of online access to medicines for self-care in the low and middle income countries, I would say that the general advantages that we have seen with online pharmacies hold very true here. That is, there is increased access and equity, convenience for the patients, yes, and cost saving, definitely. And tracking of medicines, the documentation part is excellent when it comes to e-pharmacies. Having said this, we also have to know what are the disadvantages because of the different situation in LMIC compared to
Manjari, we cannot hear you. Are you here?
Yes. Yeah. I'm here and I'm getting connected back in a second. Can you hear me?
Yes.
Yes.
Manjeri. Manjeri, we cannot hear you again.
I'm so sorry. So having discussed the advantages in the previous slide, now that we know what is the situation in LMIC, let's put all these pieces together. And I can say that even though there are advantages, we have to be cautious that there is low health literacy among the consumers in LMIC. There are no legal provisions for the online pharmacies. Either they're absent or they're not very clear. They're ambiguous. There is lack of provision of consumer medicine information. So there is no guidance to the use of medicines for the consumers. GPP not yet well established, and there is usually in most countries people have good access to the medicines via their neighborhood pharmacies. There are of course so putting all these pieces together, I can say that there are higher chances of responsible self-medication, wrong use of medicines, as far as self-care or prescription medicines are concerned. Online pharmacies may cut down the scope to develop role of pharmacists, which had just started evolving, and will further reduce the face-to-face interaction with the pharmacist. There is higher potential for illegal operations, looking at the loose enforcement of the laws, substandard quality or fake medicines causing concerns about patient safety, and of course, disruption of existing network of pharmacies is possible. So, online access to medicines in LMIC has its own set of advantages, but also has disadvantages. But as the world has evolved and the digital tools and internet is spread all over the world, we have to go with this development. One should move ahead with this development. But what is needed is online access has to be coupled with the use of different digital health tools for the consumer education. That will definitely add value. There should be clear policies and there should be robust regulations and strict enforcement for these pharmacies in online space. Development of e-pharmacy models has to ensure that there is supply, there is provision of safe medicines through the appropriate logistics, and there has to be consumer education, rigorous consumer education regarding identification of the genuine websites, giving them full confidence that whatever they're doing, it is for their safety. After all, patient safety and well-being is most important regardless of mode of access to medicines. And this is what I wanted to discuss regarding the online access to the self-care medicines in LMIC countries. Thank you very much for your kind attention. And I'm again sorry for the interruptions which I had because of the poor Wi-Fi. Thank you. Thank you, FIP, for this opportunity. Thank you very much.
Thank you so much, Manjeri, for your great and very interesting presentation. Our next panelist is Filipa Alves da Costa. So she is assistant professor in University of Lisbon, Portugal. She is also associate researcher in pharmacy practice, IMED and CIIEM, and also senior researcher in medicines effectiveness National Cancer Registry. And her very interesting topic is what are the advantages and disadvantages to accessing medicines online for self-care, high-income country perspective? Stage is yours, Filipa.
Thank you very much. So good morning, good afternoon, and good evening, everyone. It's a pleasure to be here. And before starting, I would like to thank the Community Pharmacy section for this kind invitation. And as part of the Executive Committee of the Social and Administrative Pharmacy section, I would like to pass on the regards from our president and the gratification to be associated with this event. So if I could have my first slide, please. So to be able to discuss access to medicines online to support self-care, it's important to first understand the boundaries between some core concepts that sometimes are used interchangeably. And these are eHealth, mHealth, and telehealth. So on the left-hand side, you can see an FIP report that was issued in 2019 on mHealth, where these concepts are very clearly explained. And also the WHO, in collaboration with the Global Observatory for eHealth, as defined mHealth as medical and public health practice that's supported by mobile devices, such as mobile phones, patient monitoring devices, personal digital assistants, and other wireless devices. So mHealth is considered a component of eHealth, as you can see on the figure on the right-hand side. And eHealth is a broad umbrella term which refers to health services and information delivered or enhanced through the internet and related technologies. So access to medicines may be done through the internet in its most varied forms, either through the apps, mHealth, or through the traditional internet, wireless health, or even by telephone requests. And then we talk about telehealth. Next slide, please. So just over 10 years ago, WHO has produced a report where it has highlighted the 10 leading causes of inefficiency of health systems. And these are still very much present in the current times, both in high and low income countries. So I think that's relevant to reflect on this. The reason why I put this here, I will not go through the 10 of them, but it's because some of them I believe that could be minimized by the use of the internet. So the ones where you see the M refer to medicines, and these are, for example, the underuse of generics, the use of substandard medicines, and the inappropriate and effective use of medicines. Then you have those that refer to the healthcare professionals or the healthcare services, and which include the overuse or the inappropriate use of healthcare services. And then finally, those that are related to workforce issues, and these include the inappropriate use of workforce, or sometimes even a lack in CPD to ensure competence to prevent medication errors. Thank you. So I'll start by the core aspect in pharmaceutical policy, which is in fact access to medicines. And I'm sure that regardless of the country where you're listening to this webinar, you can think of situations where access to medicines cannot be taken for granted. I really like this picture on the middle here, which is a picture from WHO, where you can see the efforts that have been made to make sure that vaccines reach even the most remote countries. But even so, there are around 50% of children that still do not get their vaccines. So how does the internet help this? You can see here on the right-hand side on top, this was an initiative that was developed in Ghana, through which 12 million people benefited from the world's largest drone that was used for medical delivery services. And there were flights that were made every day to make sure that health centers in remote areas of the countries could receive the medicines they needed. But also there are other examples, maybe more close to people in high income countries, such as Portugal, where I come from. And this picture on the top right-hand side, you can see this was an initiative that was developed by an independent community pharmacy, where the people that were isolated following some tragic fire events, through the use of drones, they ensure that these people would still receive the medicines they needed every day. So all these aspects really refer to the puzzle that you can see here about access to medicines, and they refer specifically to point 4, which is reliable health and supply systems. But you can also think of less tragic situation in your daily life. I give you here 3 examples, 2 of them extracted from Portugal and 1 from the UK. The 2 from Portugal on the left, one of them is developed by the National Association of Pharmacies, and it basically consists of an interface, a platform that's created between primary care, healthcare units and pharmacies. And they make sure that people get their medicines, especially the urgent ones, on time. The other initiative that's further down, it's developed by the regulatory agency, and it's aimed to support people in having access to generics and being able to have informed decisions on the generic they want to use. So through this app, they have all the information about the options available, how much they cost, so that they can reach the pharmacy and choose the one they prefer. In the case of the UK is an initiative developed by the NHS, through which you can have a repeat prescription. And through this repeat prescription, you can then, through the mobile app, get your medicines delivered through a locker system. Can I have the next slide, please? Now, during COVID-19, lots of different innovations have been developed worldwide. I give you an example that's detailed in a paper published last year, where you can see that pharmacists all over had the capacity to transform the challenges into opportunities. And in various parts of the world, legal and practice changes were implemented to make sure that people could continue to assess their medicines. So in Hong Kong, for example, there was a group involving community pharmacists working collaboratively with physicians that initiated a new medication refill service, and anticipating the possibility for patients to access their hospital medication through a community pharmacy instead of having to visit the outpatient pharmacy in the public hospital. Also in Spain, there were regulatory changes approved that consisted basically of having a home delivery of medicines to ensure continued supply of medicines for pre-existing conditions. Again, I mentioned Portugal. I'm maybe a bit suspect because I come from there, but in here we had two new decrees that were quite important. One of them enabled community pharmacies to deliver hospital-only medicines for extended periods so that people would not be deprived from essential medicines. But we also had another decree that enabled people living with chronic illness to have automatic renewal of their prescriptions. Also in Brazil, there were some remote solutions created that ensured the continued supply of high-cost medicines used in transports, multiple myeloma, and HIV. And these services included telephone appointments provided by students and professors of the pharmacy school that would be used to verify the supply and also advise on the responsible use of medicines. Next slide. So pharmacists, as any healthcare professional, should aim always to provide the services that consumers desire or those that meet their societal needs. So this paper I show you here presents some data from an interview that was conducted with over 1,000 people, and it shows that 36% of the respondees used pharmacy as a first resource when seeking to treat minor ailments, but also 54% reported to use the pharmacy when seeking answers about their medicines. So both services seem to be perfect candidates for online provision of services. Like the picture you have on the left, where you have a GP at hand, we can also have a pharmacist at hand to help consumers deal with their constant queries. But in addition to this research also shows the importance that's attributed to services that are already available in pharmacies, but more interestingly, 1/3 of respondents mentioned that there could be more services than those that are currently provided by pharmacies. And those that are most valued were point-of-care testing, support in managing and controlling disease, and support also in the choice of non-prescription medicines. So we get to the internet era. Next slide, please. And you can see that there's always some debate to what extent these innovations will cover the entire population. And currently around 60% of the world population uses the internet. And although access is unequal across and even within countries, most of these differences seem to refer mostly to the wideband coverage. However, it's also important to note that there are some age groups that have markedly increased their use of the internet during the current pandemics. And those were, of course, the teenagers and progressively decreasing by age groups. And this is a point that we should bear in mind. Also, the fact that behaviors have changed dramatically as a response to lockdown measures. And we can see that e-commerce has boosted. However, medicines and health in general are still not among the top listed in this slide I show you. So getting to self-care, we can see that these interventions represent a significant push towards new and greater self-efficacy, autonomy, and engagement in health for self-carers and caregivers. And while it is true that the risk and benefit calculations will vary in different settings and different populations, it's important that normative guidance in a safe and supporting enabling environment will help these interventions to promote active participation of individuals in their health. And this is quite exciting because it has been demonstrated that will result in improved outcomes, as you can see them listed on the slide. In fact, the new declaration of Astana has highlighted the potential for the advancement of health and well-being for people that must rely on primary health care. And this declaration calls for the mobilization of all stakeholders to focus their efforts on three main elements of healthcare provision. One is meeting people's needs through comprehensive and integrated healthcare services throughout the entire life course. The second one is systematically addressing the broader determinants of health through evidence-informed policies. And the third one, which is particularly important in the context of this webinar, is the empowerment of individuals, families, and communities to become active self-carers and caregivers. So Manjiri has already introduced WHO's definition of self-care, which I have in the next slide, please. Which I will not go through again, but I would like to highlight the important point of this definition, which is the recognition that individuals are active agents in managing their own healthcare in various areas. And these include health promotion, disease prevention and control, self-medication, providing care to dependent persons, and rehabilitation, including palliative care. So by the recognition that people are now able to access new information, products, and interventions through internet, that means that digital, that means that there must be an improved concern in ensuring this is made in a safe way. So WHO in 2020 has issued this conceptual framework for self-care, where it mentions that individuals can be in control of some healthcare interventions, such as using condoms, but others, such as positive HIV tests, will need will need reconfirmation within a healthcare setting. And there are still other interventions, which is self-sampling of HPV, which will require the health setting to do the test. So it is very important to understand that the health system supporting people for self-care in managing their condition remains a core and central part of self-care. This is very, very important in the current pandemic context, because as you know, since November 2020, that the FDA has approved the self-tests for COVID, and more recently, the EMA has also approved these tests. We need to bear in mind that COVID-19 has been declared a public health emergency of international concern, which means that it must be reported to the competent authorities. So the ECDC has also recently, just last month, issued a report where it highlights that the use of self-tests for COVID-19 has the potential to increase underreporting of the disease, and also the potential to decrease the compliance with control measures that must be implemented, such as quarantine and contact tracing. So this partially answers one of the questions that was actually placed on Facebook, that was put here on the chat box, about the importance for the healthcare system to support self-care decisions and to ensure that empowerment is not made in a so conscious way. So in summary, I would say the internet and self-care has advantages and disadvantages, of course, but in terms of advantages, I will highlight the increase in personal empowerment, also the potential to overcome some workforce shortages, but perhaps most importantly is the ability to support the achievement of the WHO's triple billion goals, which is to improve universal health coverage, reach people in humanitarian situations, and also improve the health and well-being of all people. Of course, in terms of challenges, Manjiri has also highlighted some of these that are common to high-income countries. One of them is surely the unsafe use of unregulated and substandard products. But the second one, and I put very much emphasis on this one, is the incorrect or unclear health information that is currently being conveyed with the emergency of fake and misleading news on the internet. And I think the pharmacist has a major role in preventing or correcting these situations. And finally, coming back to the graph where I showed you the use of the internet in population strata, I would like to highlight that the use of the internet has also an enormous potential to aggravate inequalities. And I will highlight here the vulnerable, marginalized, criminalized, and socially, economically underprivileged populations who often have many restrictions to the use of these situations. So if we are to develop service being delivered online, we must ensure that services are still available offline so that these populations can keep receiving them and having access to self-care to support them. Thank you very much for your attention.
Thank you so much, Philippa, for the great and very interesting presentation. So our next panelist is John Hertig. So he is the board president from Alliance for Safe Online Pharmacies, USA. He is also associate professor, vice chair of pharmacy practice, and fellowship director in Butler University College of Pharmacy and Health Sciences, Indianapolis, USA. He is also vice president of the BAHO region, Hospital Pharmacy Section, FIP. And his topic is very interesting: online pharmacies and patient safety in terms of self-care. Stage is yours, John.
Thank you very much. Sorry for that kind introduction. Thank you to my colleagues for wonderful presentations, and a special thank you to the community pharmacy section of FIP for the kind invitation to talk about a topic that I'm very passionate about. Next slide, please. As our previous presenters described, there are many reasons why our patients or consumers go online. The three biggest reasons are convenience, cost, and access to care. If you had asked me 10, maybe 15 years ago, whether our patients should go online to access care, I probably would advise them to stay away from the internet. Clearly today, we live in a very different world where e-commerce dominates a lot of sales of all types of products. And so telling our patients or telling consumers to avoid the internet is no longer a viable option. Instead, we as pharmacists need to embrace the internet, need to embrace technology, and work with our patients and work with consumers to navigate a very complex environment safely. Because ultimately, our job as pharmacists is to ensure that our patients receive the safest possible care. Receiving safe self-care will be a major theme in the next 15 minutes as I describe some of the dangers of going online as well as some of the opportunities. Next slide, please. There are so many patient protections that are often bypassed online, and our previous presenters have done a very nice job at highlighting the benefits as well as the risks of accessing care, especially medicines, online. From prescribing to the pharmacist to the regulator, all of those patient protections are bypassed by many who don't go through standardized process to access medicines online. Now, fortunately or unfortunately, there are many opportunities for our patients to access online pharmacies. At any one given time, there are approximately 35,000 to 45,000 online pharmacies in the internet today. And not all of those are operating legally, and most of them are operating nefariously. Approximately 95% of this number are illegal online pharmacies. Next slide, please. And how does this work? This is a graphic from the Fisher College of Criminal Justice in the United States that talks about how rogue internet pharmacy operations take advantage of our global network, of our global supply chain. As I go through a quick example, please keep in mind, it is not my intention to place blame or to call out specific countries. If I'm using specific countries in this example, it's only because it's supported by evidence. So please don't take it as blaming a particular region of the world. In my example, a US consumer may look online for a cheaper price. Maybe their cost of their drug is too high in the United States, which is not uncommon. And so they look for an online pharmacy. That online pharmacy may be located or proposed to be located in Canada. They go online, they type in what medication they need, a Canadian pharmacy pops up, but it is actually not a Canadian pharmacy. That Canadian pharmacy is actually hosted perhaps by servers in Russia or Brazil. That patient in the United States places an order with that online pharmacy, which doesn't ask for a prescription, doesn't do a patient consultation, offers no clinical advice, and instead it's just a transaction that perhaps is processed through a bank in the Middle East. That transaction, once approved and processed, is then filled by an off-site location, perhaps in Mauritius or Pakistan, and then that medication is shipped to Canada. And it's shipped to Canada, usually it's received by one individual in one central location, it's repackaged with Canadian labeling, and then shipped to the United States to make it look like it's from Canada. All the while, the patient has no idea that they may perhaps received a substandard or falsified medicine, or perhaps they received a medicine that required cold storage, like insulin, and that wasn't adhered to. So they receive a product that could potentially harm them or not help them without them even knowing. This is how rogue internet pharmacies take advantage of our internet supply chain and our global operations. The last line of defense is you as a pharmacist to help people understand and become educated on safe ways to access medicines online. Next slide, please. Why is this a problem? Well, I'm sure you can understand that If you work with an illegal online pharmacy, if you're not sure of the source of your medicine, then you have a lot of potential issues that can arise from selling substandard, falsified, or unapproved medicines, selling prescription medications without a prescription, thereby circumventing those patient protections that we talked about, which is really important. Because of that, there are risks of under or overdosing, significant risks of drug interactions, adverse events, as well as financial fraud. These criminal networks that have these rogue pharmacy operations not only perhaps sell you substandard or falsified medicines or unapproved medicines, but also are collecting your home address, are often collecting your patient or payment information, thereby resulting in financial fraud or identity theft. Illegal online pharmacies is big business, and online drug sellers can make anywhere between 1 and 2.5 million US dollars in sales each month. These illegal operations are now more lucrative than illegal arms sales, human trafficking, and other criminal enterprises because the margins are so high. This attracts lots of criminal activity, with every day approximately 20 new illegal online pharmacy sites going live globally, which poses a significant patient safety issue. Next slide, please. Some of the pictures of where these medicines are filled are here, and I won't go into great detail, but as I mentioned, 95% of these illegal online, or excuse me, 95% of online pharmacies are in fact illegal in some way, which does result, in the next slide, you'll see, in some significant patient harm associated with a lot of the products that are located in these medicines, from mercury to uranium, road paint, brick dust, or just nothing at all, where you have dextrose, starch, or salt. Unfortunately, a lot of patients are harmed by these illegal online drug sellers worldwide. And if you see in the next slide, there are some examples of those patients who have unfortunately died from taking medications that are purchased online. E-consumerism will continue to increase. And if you see in the next slide, the data supports this trend in shifting buying behavior, as we have good technologies that are disrupting and improving our world, but also these technologies need to be implemented in a way and educated on in a way where we're advising our patients to go online safely. So self-care and healthcare consumerism is indeed growing. In the next slide, please. I want to highlight this increase in consumerism through the lens of the pandemic, because the COVID-19 pandemic really truly highlights how criminals and the internet can come together to take advantage of fear and uncertainty in our patients. Within the weeks leading up to the WHO declaring COVID-19 a pandemic, over 100,000 new domain names were registered containing the terms COVID, corona, virus. Many of these websites were done so to take advantage of people by selling nefarious products. 122 of the domain names even contain the word vaccine, with 400 containing the string test. In April of 2020, just a few months after the pandemic was first noticed, there were already vaccines being sold on the internet. Clearly, those vaccines were not truly vaccines. Next slide, please. In the following few slides, I just want to show a number of social media posts and other misinformation available via the internet. Again, previous speakers have gone through this, but if you search coronavirus treatment drug, you see all these different products that were pushed on consumers throughout the pandemic, most of which aren't accurate, they're not true, they're not actually medicines, and they will not help people. All they are doing is taking people's money and preying on the fear that they have of contracting the coronavirus. Next slide, please. Cures, and you can see here from various sources. Because of this major issue, because of the fact that the internet can be taken advantage of our consumers, we needed to gain some insight and do some additional research in how consumers were using the internet to purchase products during the pandemic. I led a research team, and this was based in the United States, so I will provide that context. This is a United States-based study where we sought to understand how are consumers using the internet now to buy medicines online, given the access and other issues associated with the pandemic. And what we found is that 31% of all those surveyed used the internet to access medicines for the first time because of the pandemic. If you then add in the other 16% that accessed it online for the first time, maybe not due to the pandemic, you have almost half of those surveyed going online to buy medications for the very first time, engaging in that aspect of self-care. What a great opportunity for pharmacists to get involved in educating those patients on how to do so safely. Next slide, please. And what are our patients buying online? We did a similar survey in 2017, and then we did the survey again in 2020, and we compared the different types of products that patients are buying online. You can see there's significant increases in each one of these types of products, from medications for acute conditions, OTC products, specialty medications, as well as medications for chronic condition. You see significant jumps in the patients that are accessing these medications via the internet. Next slide, please. What are health professionals doing about this? We know that the internet is a major access point for care, which comes with a lot of benefits, but also some significant risks. So what are our health professionals doing in educating our patients? We asked nurses, pharmacists, and physicians on whether they talk about online pharmacies and the potential benefits and dangers of them. You can see from this graphic all the way to the left, the dark blue says, yes, we highlight the risk. And you see anywhere between 11 and 16% of our health professionals highlight risks, but you can see almost equal, anywhere between 16 or 15 and 18% just encourage their use without going over the risks. And then a vast majority, which is the number all the way to the right, never even talk about online pharmacies at all, which represents a large opportunity for us as pharmacists to engage in dialogue and improve education of our patient population. Next slide, please. We also, in our research team, conducted a survey of pharmacists in the United States in 2019, and we asked those pharmacists about their own knowledge and competence in navigating the e-commerce space. And what we found is greater than 50% of licensed pharmacist respondents are not confident at all in their knowledge on the prevalence of illegal internet pharmacies, their ability to help patients determine the legitimacy of a pharmacy online, or the types of medications sold. These represent large opportunities for us to do better as a profession. Next slide, please. Importantly, and probably most importantly, there is harm that occurs from accessing these types of illegal online sites. Of the pharmacists surveyed, 8% indicated that one of their patients experienced some type of adverse event because of going online. 8%, which is probably higher. If you know much about patient safety, you know much of this is underreported. And so if we're close to 10%, that represents a significant number. Next slide, please. My research team and I also conducted a systematic literature review where we looked at global morbidity and mortality associated with using online pharmacies incorrectly. And what we found through that global review is that there are a number of different medications that are more commonly associated with causing harm when purchased online. You see the highly referenced, the moderately referenced, and the sparingly referenced buckets, where the highly referenced are those medications that are most likely to cause harm when purchased online without the assistance of a pharmacist. You have analgesics, restricted or recalled medications, anorexiants, as well as anti-neoplastic agents. Next slide, please. In conclusion, and some key takeaways I would like to leave with you all today, increasing consumer and patient use of the internet is going to occur and has occurred, especially this past year. Rather than avoid the internet, we as a profession need to embrace the internet and help our patients navigate this e-commerce space safely. Online pharmacies can be safe and potentially even more cost-effective, providing benefits of access and others that our presenters have gone over, which is alternative to traditional brick and mortar pharmacies, but these must be thoroughly reviewed and vetted. Pharmacists and other health professionals have limited knowledge on illegal online pharmacies, their prevalence, as well as their impact on our patient populations. We need to learn a little bit more ourselves so that we can help our patients understand how to access care safely. This is truly a global issue. Not only does it take advantage of our global supply chain, but it impacts patients in all different countries, from our higher income countries to our lower and middle income countries, resulting in serious negative impact on public health and patient safety. Foundationally, educated consumers do take less risks. That means more education is needed, not only to healthcare providers so that they're armed with the information, but also to our patients and consumers. Use the various resources available to keep patients safe when going online, and always, no matter where you are in practice, ask not only what are you taking this for, or how are you feeling, but ask, where do you get your medication? Are you getting your medication only from me? Are you only getting your medication from a safe source? Or are you going online? And if you're going online, are you going to a safe online pharmacy? It's up to us as a profession to intervene because we are the medication use experts. So with that, I want to thank you for your kind attention to this presentation. On this slide, there's a listing of just a sampling of the many organizations that are involved in combating this important patient safety and self-care issue. I look forward to the panel discussion. Thank you very much.
Thank you, John, for your very interesting and great presentation. So now we have time for panel discussion. And I would like to still once to thank you all, Manjiri, Philippa, and John, for your great presentations. There have been a lot of discussion in our quality assurance box, and we can continue it now. So at first, I would like to ask you, how do you see the future role of internet pharmacies in self-care? How it will be developed when compared to conventional pharmacies? Would you like to answer first, Manjiri, what will happen in Asia?
Thank you, Sari, and thanks to all both the colleagues for excellent presentations. And this is a very good question. I'm sure the way internet, the smartphone, and digital technology is penetrating all over the globe, there will be the online pharmacies, the online access to medicines will be evolving further. And more, there will be more development in this sector, and more people will be accessing the online medicines, as John rightly said, especially due to COVID pandemic. So I see the future for online pharmacies. Yes, there is a huge scope and opportunities for the online pharmacies in the coming years. Only thing, we always have to be cautious because we know what could be the advantages, but we also are aware what could be the threats or the disadvantages of these online pharmacies. But there is great future, and there are big players, e-commerce players coming into online pharmacies. We have recently read about it. And so, yes, that's it from me. Thank you.
Thank you, Manjiri. And the same question for Philippa. So how do you see the role of internet pharmacies in self-care, how it will develop when compared to conventional pharmacies in Europe?
Mm-hmm. Thank you for the question. I think that question also refers to some comments that have been placed on Facebook. And for me, the question is not so much if we are going to be talking about the negative parts of technology. We are not in the position to do so. The internet has arrived long time ago, and we need to adapt quickly. In fact, in my opinion, we should have done it before, but it's still not too late. The main problem I see is the mentality of us pharmacists, that we need to make sure that there's a change in the culture and in the way we manage pharmacy as an organization. We cannot expect the same pharmacist to be at the counter, be answering online, be providing pharmaceutical care or any type of advanced service. And sometimes the management of pharmacies is not done in the way that will enable all these different and parallel services to be developed efficiently. And that is why sometimes we have those big companies or giants, as you call them, coming into the market, because they can do that much better than we can. So the challenge for me is surely to make sure the workforce is properly allocated and that we have enough staff to be able to accompany the delivery of products with the delivery of services, regardless of being done face-to-face or online.
Thank you, Philippa. And what about John, in the USA? You have a bit different market there. What do you think?
Yeah, thank you for that question. And I would just like to emphasize the great responses from my colleagues who are completely accurate in their responses. And what I'll add is, this is a complex issue. This is an incredibly complex issue. The use of the internet and its intersection with healthcare is not simple. And so it's going to take some complex problems that result from multi-stakeholders getting involved. And clearly we need to make sure that there's a regulatory framework that supports safe access to care. We need to make sure that there's a robust education platform and program that builds capacity and understanding within our healthcare community, as well as our patient community. And to be honest, we need to do a better job at getting our internet companies and our social media platforms to the table to actually collaborate with us. And we're struggling with that a little bit, because there's this perception that the internet is unregulatable or untouchable, but we need to get past that and make sure that the big players are coming to the table working with us, because I think it's in their best interest to ensure that what they're providing online, whether it be misinformation or whether it be substandard or falsified medicines, is shut down, because we want to make sure that we clean up the internet as best we can. And what we're seeing as traditional websites are cleaned up is these criminal networks, and this unsafe care is moving to social media, to platforms like Instagram, platforms like Facebook, to Snapchat. And so we need to make sure we're as proactive as possible, working with all different stakeholders, both within and out of the healthcare community, to address this issue.
Thank you, John. The next question for all of you. So how do you see the possibility of taking care also in the future that there are no fake medicines in internet pharmacies when providing products for self-care? What do you think, Manjiri? What is the situation in India or in Asia?
Yes. So thank you, Sari. So patient safety, we are always talking about the harm to the patients or the patient safety. Regarding the legal provisions for the online pharmacies, as I mentioned, many countries do not have very clear dedicated laws for the internet pharmacies. And so there is chance for the substandard, there is chance for the counterfeit, there is chance for the fake medicines coming through the illegal websites, or the websites which are not operating in a proper way. Their operations are not well defined, and there is scope for, there are loopholes for these kind of misdoings. So there has to be a very clear policy in the country. There has to be a legal provision and the laws which can be enforced well to control these pharmacies. As I always say, that it is very difficult and challenging to control or to regulate the pharmacies in the online space than going to the neighborhood pharmacy and controlling it or taking an action. So the regulators have also to be well equipped. They need to be understanding the technology more, and they should be very well equipped with the ways of regulations, with the ways of control to capture all these issues. And secondly, consumers should be very well educated. They should know what they're doing is right or wrong. So we need to, as my colleague said, that healthcare providers also have less knowledge of patients who don't have the correct knowledge, who don't have that level of understanding. So we need to educate them. And on the other side, we have to have a very clear legal provisions. In the United States, I think the Ryan Heights law for the internet pharmacies came because of a big mishap, because of the controlled substances ordered something. So we don't want to wait for such mishaps. We know what are the problems, what are the threats, and there have to be a very clear, robust legal provisions, and should be enforced very well. Thank you, Sari.
Thank you, Manjiri, for the very good answer. So how do you see, Philippa, the situation in Europe?
I think it is true that the internet potentiates the use of substandard medicines, this has been quantified very, very well. However, there are initiatives that have been developed throughout Europe. One of them is the EU common logo, and other regulatory agencies at the national level, and even sectorial associations that have been developing various campaigns. So the main issue is not so much about, for me, finishing or diminishing falsified medicines, but it's about making sure that people are informed. And in a way, it's a bit like drugs. Drugs will always exist, and it's important to understand that self-care is about empowerment. So we need to give people the opportunity to make their choices, but they should be able to make informed choices. So the regulatory system, in fact, has a major role in there to make sure that the pharmacies that operate online are accredited and are well signaled in a way that consumers can distinguish the difference between ones and the others. And then if they want, they can always go to the unlicensed ones. It's their choice. The risk here is lack of information, as Manjiri stated, and I totally agree. However, it's also important to mention that some additional initiatives have been developed in terms of the circuit of the medicines. So when a falsified medicine reaches the market, it's because something went wrong in the process, which is long. And through the use of wireless systems, we have the possibility to create automatic coding systems that can help us identify in the various points of the circuit where things can go wrong and prevent them from reaching the consumers. So there are also advantages in terms of counterfeit medicines.
Thank you, Philippa. So what about John? What is the situation in USA? How do you see that?
Yeah, thank you. And I do enjoy going last because I get to build off the wonderful comments of my colleagues, and they're exactly correct. There have been some really important initiatives to help consumers make good choices, because that's what we need to be doing, is empowering our consumers to make good choices. And simultaneously, when they have questions about those choices, they come to us as pharmacists and we can then help guide them. And I think that's the other part of that educational of need. In Europe, the common logo has been a good first step. I think one of the issues and one of the criticisms of common logo is that the common logo itself can be counterfeit, which presents its own set of issues. And so the Falsified Medicines Directive is another initiative out of the European region that's done wonders, I think, hopefully for preventing falsified medicines from entering the supply chain. In the United States and now growing globally, there's also the .pharmacy initiative, and I'm not sure how many individuals are familiar with .pharmacy, but that's an initiative out of the National Association of Boards of Pharmacy, where registered legitimate pharmacies can apply for the top level domain. So rather than .com or .gov or .eu, they receive a .pharmacy top level domain, which cannot be counterfeit. It cannot be obtained in any other mechanism other than through NABP. And so if we as pharmacists adopt something like that, I'm not promoting that as the only solution, but if we adopt something similar to that, then we can provide patients with the education around where to go and say, look to the right of the dot. Look for .pharmacy. We're empowering you to select medicines online, but if you want to do so safely, here's a great avenue to do that, just like a common logo or some of these other programs that have been put into place. Clearly, we need to do better at promoting those types of offerings if it is something we are going to adapt worldwide. But I just want to mention that. And then there are technologies that are emerging and becoming in greater use, like RFID and others that have great potential to really enhance the safety of our supply chain, and again, give patients the tools that they need to access the care that they need. Thank you.
Thank you, John. This is very interesting. And one more question for all of you. Sharing information how to use medicines in the right way in the self-care in internet pharmacy is essential. What do you think how this information sharing will be improved and developed in the future? What do you think in Asia, Manjiri?
Good question, Sari. And I think the digital health tools have to be used to educate the patients, and maybe a messaging system for the patients or some other ways where we can inform the patients about the responsible use of medicine, because we are talking of the online space where the face-to-face interaction is not there. So there could be a telephone calls or the messages or some other technologies can be used to be connected to the patients. There are helplines available, and where the pharmacist is on call all the time. So these type of these provisions have to be there so that the consumer has access to the advice from the pharmacist, has access to the health information, has access to the medicine information, and also the medicine information can be given to the patient when the medicines are sold online. So there can be an easy way out from the using technology to provide that information, what is required for the patient for the use of medicines. Maybe John and Philippa can add more on it.
Yeah, well, I would just add, and going back to the point on the first question, that consumers do not want a standardized response that's previously written somewhere on the pharmacy website. They want a specific answer to their query, and they want it immediately when they ask it. They do not want it 24 hours later, which is what we normally do best. So I would say that would require definitely a person on a back office being available full-time to provide that service. And that is something I think it's really lacking. There are initiatives being developed by the hospitals, by the regulatory agencies, by the pharmaceutical societies, but normally people want to talk to their local community pharmacist, even if it's through a chat line. So that's the investment that we need to make.
What about in USA, John?
Yeah.
Very similar. I mean, our consumers today want on-demand responses and on-demand education, and we need to be ready to provide it when they need it, because if we aren't ready when they need it, they will go elsewhere, and typically they go online for that as well. And there, as our previous speakers have mentioned, also an infodemic. In addition to a pandemic, there's an infodemic worldwide where there's this viral spread of misinformation. And so it's very easy for our patients to get caught up when they seek some of that information elsewhere in this spiral of receiving negative information. And that's very hard, because then they lose trust in the system, they lose trust in the care that's being provided, which presents a different type of public health issue and emergency. So we need to be ready, and I think we can be ready. I think FIP has done a very nice job. The community pharmacy section and organizing this webinar should be commended, because this is one of the ways that we can put forth better information, not only to ourselves, but to our patients. Because in addition to the pandemic, we really need to stop the infodemic that's occurring with regards to a variety of topics worldwide.
Thank you, John. And Manjiri.
Yeah, I would just like to add what John and Philippa said. Sometimes we have seen that people in our part of the region, I mean in India, they order online medicines and they don't understand about it, and they go to the local pharmacy and ask the questions to the pharmacist in the neighborhood. So this is kind of a totally blended model, you know, so where you see the importance of the pharmacist giving the information to the patient. So pharmacist loses the business, but he has to advise the patient, and he does that.
Yeah. Thank you, Manjiri. And once again, thank you, Manjiri, Philippa, and John, for your very, very interesting presentations. There has been a lot of discussion in our quality Q&A box, and there are very nice and interesting answers also. Now I would like to wrap up our webinar. And thank you once again so much, Manjiri Karat, Philippa Alves da Costa, and John Hurtig, for your very interesting presentations, and also for our audience for following us and for your valuable questions. What we have learned today. our conclusion. Manjiri learned us that online access to medicines and low and middle income countries has its own set of advantages and disadvantages. After all, patient safety and well-being is most important regardless of mode of access to medicines. What is needed there? Online access coupled with use of digital health tools for consumer education will add value. Policies, robust regulations, and strict enforcement for the control of pharmacies in online space. Development of e-pharmacy models to ensure supply of safe medicines through appropriate logistics, and consumer education regarding identifying genuine websites. What we learned from Filippa: benefits in internet and self-care are to increase person empowerment, to overcome workforce shortages, and meeting needs for healthcare. And what we learned from John: there has been increase in consumer and patient use of the internet, especially this past year during the COVID pandemic. Online pharmacies can be a safe and potentially cost-effective alternative to traditional brick-and-mortar pharmacies, but must be thoroughly reviewed. Pharmacists and other health professionals have limited knowledge regarding illegal online pharmacies. A global issue involving many drug classes resulting in serious negative impact on public health and patient safety. Educated consumers take less risks. More education is needed to healthcare providers and consumers, patients. Thank you all for your attention. FIP would like to thank Sanofi Consumer Healthcare for supporting this online event. And in the next slide, check all future FIP digital events here, events.fip.org. Thank you all being part of this webinar. Thank you and bye-bye.